She does want it. She wants to eat it. This is probably, and this is a nice, not too hard for her.
We request everyone to please mute yourself once you join. Once you join, please mute yourself and we'll get started soon.
Yeah.
Mahesh bhai, should we get
I
started?
think, yeah, because it's 10-1. Yes, please. Yes.
All right. Jai Jinendra, everybody. Let's get started on this China's educational talk on COVID-19, specifically on the vaccine special. Before we get started, I would request everybody to please fold your hand, close your eyes, listen to our Navkar mantra. Jai Jinendra, respected Jaina President Mahesh bhai, invited speaker Dr. NIRAV SHAH, question and answer moderator Dr. Nitin Shah, Jaina Executive Committee, and Jaina community members and all. I, Hemant Shah, Jaina Secretary, very warmly welcomes you all on this third educational talk by Jaina on COVID-19 vaccine special. Happy holidays. I appreciate you all and thank you for joining to learn more on COVID-19. It's fair to say that COVID-19 has been with us longer than we ever expected. Now with available vaccine, we see some hope, startup of an end of COVID era. And everybody please go on mute if you're not talking. Thank you. We are continually learning something new every day, and now with vaccine rollouts, we have many more questions like, what is this vaccine? Why do I take it? Which one should I take it? How effective it is, etc. And to care for you and help educate on vaccine and reduce the spread of this virus. This is second time we have invited Dr. NIRAV SHAH, an infectious disease specialist, and our own Dr. Nitin Shah. Without further ado, I would now like to invite our President, Sri Mahesh Bhai from Los Angeles, California, to introduce our speaker, Dr. NIRAV SHAH. Mahesh Bhai.
Jai Janendra, thank you. Thank you, Aman Bhai. Pranam and Jai Janendra. Thanks to everyone for joining. I hope you all are in Sukh Shata and are all safe at home and are in good health. On behalf of Jaina Executive Committee, I want to wish everyone a blessed new year with health, wealth, and happiness. COVID-19, a global pandemic, has infected more than 76 million and killed over 1 million people worldwide. This has devastated the global economy and disrupted daily life for the entire population. There are various vaccines available now, and it is considered as a start of the ending of COVID era. There are myths and misunderstanding on vaccines and current strains on the virus. Please join Jaina's third COVID-19 educational talk, this time by Dr. NIRAV SHAH, who is an infectious disease physician at North Shore University Health System, who has also done masters in public health. He is a medical director of quality innovator and clinical practice analytics at North Shore University Health System. During COVID pandemic, he has been involved in building infrastructure and capacity for COVID clinical trials. He is also helping with health system recovery and COVID research and disparities of care. He had spoken to us about COVID-19 in the past, and now he has kindly agreed to educate us with COVID vaccines. My heartfelt gratitude to Dr. NIRAV SHAH for giving us his valuable time today to provide us with information on COVID-19 vaccines. Without further delay, it's my pleasure to invite Dr. NIRAV SHAH to please deliver his talk. Thank you. Dr. NIRAV SHAH, please go ahead. Thank you.
Thank you, Mahesh Bhai. Before Dr. NIRAV Shah start his presentation, I'd like to introduce, he doesn't need any introduction, but I still like to introduce our own Dr. Nitin Shah, who is a professor of anesthesiology and critical care at Loma Linda University. He is the interim deputy chief of anesthesiology at Tibor Rubin VA Medical Center, Long Beach, California. Dr. Nitin Bhai is also a past president of Jain Center of Southern California. He is a founding president of Anekant Community Center in Los Angeles. And he's a chair of Jaina's Awards Committee. He's also a vice chair of Academic Liaison Committee and a member of Jaina Interfaith Committee. Please join me welcoming our question and answer moderator, Dr. Nitin Shah. Thank you. And now I would like to request Dr. NIRAV Shah, please take it over.
Sure.
Dhiman, please mute everyone, okay? Dhiman, mute everyone except NIRAV.
Sure.
All right. Thank you for that warm introduction. Can you guys see my slides?
Yes.
Okay, perfect. So thank you for that introduction. So my name is NIRAV SHAH. I'm an infectious disease physician. I have roles in clinical infectious disease. I have roles in analytics, roles in research, roles in clinical trials. I have a public health background. So I have kind of expertise in a lot of different areas. So I'm kind of like a jack of all trades, a master of none. But I'm hoping that I'll be able to kind of go through quite a few things that may be of interest to you. And I reached out to Hemant Uncle, Mahesh Uncle, basically to say that I think this might be the right time to kind of, have another discussion on COVID, because I've been getting a lot of questions about the vaccine from family and friends and relatives. And I figure that there's probably just a lot of questions kind of in the community, and that it would be helpful to kind of go through this. As part of the talk, I'm going to actually talk about a few things. The vaccine is one of them, and that will be the bulk of the talk. But I'll also talk about epidemiology, treatment, the new variants that are occurring in the UK and South Africa. Then I'll have Dr. Nitin Shah moderate the question answer. And I know that we've already gotten quite a few questions, so we're hoping for a very robust kind of conversation around that. I just ask if everyone could mute themselves. I'm just hearing some feedback. So what is occurring globally and nationally? So like Mahesh Uncle said, there are 80 or so million global cases. The US is kind of leading in terms of the number of cases at 19 million. And that translates into 332,000 deaths in the US. And this is the most up-to-date data that I just got from Johns Hopkins. India is a close second, rather I'd say a distant second at 10 million. This pandemic has affected every country, every continent. Antarctica was recently in the news for having an outbreak there. So there's no continent that has been spared of this. So this kind of goes through, I think this is from the New York Times, just kind of how the pandemic has, how the waves have kind of come. So in the spring, we had a wave. We had a shutdown that didn't really get the numbers down. Then we had as we were opening up again, we saw another wave, and this is really essentially the third wave, or some people call it the second wave, in the winter. If you can see the number of hospitalized patients, sorry, can you guys still see my screen?
Yes.
We stopped seeing your slide.
We don't see the slide.
All right. I'm seeing someone is kind of hijacked the screen. So, okay. Can you see it now?
Yeah, it's
Yes.
Okay, perfect. All right, so if you can see this, the daily death count has reached about 3,200. So this is, we've really accelerated kind of in the morbidity and mortality, of this wave of the pandemic. And the number of people that have been hospitalized, 117,000, means that hospitals are completely constrained. And in certain places, I know a lot of folks from here are in, Southern California. In Southern California, there was just in the news, there are 0 ICU beds right now. So this is extremely serious, what's going on. This is a graphic of where COVID is prevalent. And, if you look at this, there's no area that's spared. So this is a disease that it's affecting rural, urban, red, blue, minority, majority, it affects every state and it's affecting everybody. When I gave this talk last time, this is what the map looked like. So it really was, as we were starting to reopen, we were starting to see this in, the southern part of the United States, but there were a lot of communities that hadn't witnessed kind of the devastation of. This is an interesting graphic that shows the share of ICU beds occupied. So this is something that, healthcare providers and workers have been talking about for a long time, that without mitigation efforts such as masking, staying at home, trying not to get together during holidays, we're seeing kind of this wave of patients coming into the hospitals. And what's happened is, in a lot of places, especially out west and in the south, we're seeing the share of ICU beds occupied reaching around 100% or even over 100%. This gets at some of the mitigation efforts that are occurring across the United States. So if you see the upper left, businesses are closed in a select few places. Mandatory masks have actually increased over time as more and more states have been hit by the pandemic. The actual rate at which masks are being used right now is at its highest. It's around 72%. So a lot of places are mandating masks. Even the places that don't have restrictions, we're tending to see more and more masks because it's hitting home. And then in terms of stay-at-home orders, there's a few places like California, North Carolina, and Ohio that have stay-at-home orders because of just kind of how affected they are. The two biggest states right now that are affected are actually California and Tennessee. They're the two places. And what's interesting about California is California has masks. The businesses are shut down. There's a stay-at-home order, but yet we're still seeing that spike. And there's a lot of thoughts as to why that might be happening. One of the things is when you look at actual cell phone data, you see that even with the stay-at-home order, people are still moving around just as much as they were, before the stay-at-home order. So there's a lot of things that are, going on to kind of explain some of these reasons. This is a projection as to what we're expecting in the next few months. A lot of people ask me, the vaccine is coming. Will we be able to get masks soon? That's not the case. This is probably the most well-known group that's doing projections. Back in the beginning, they're projecting 200 to 1.2 million people dead. When we, right when we were starting to reopen, they had some projections for January that are fairly spot on. So these are probably, this is probably as good as you're going to get in terms of projections. And the new projections that they just came out with is they're projecting that up to 731,000 Americans could die of COVID-19 by April 1st if states begin to ease mandates and vaccine isn't rolled out as planned. But if depending on the pace of the vaccine rollout, we can potentially save a lot of lives if that's sped up. And then mask wearing, which is one of the most important things we can do. If we continue to wear masks, we can have significantly fewer deaths just by, all of us wearing masks. I think I mentioned 72, so 74% is right now where the mask wearing is at. And they project, even with the vaccine rollout as in its current state, continued mandates, they still project 567,000 patients or people in the US will die by April 1st. So, when we think about this as the beginning of the end, we still have a long way to go. So it's still important that we continue this, even though, it's fatiguing to basically, to mask and avoid family and stuff, but we still have a long way to go even after we're vaccinated. This graphic is, I put this up because I thought this was a really interesting, an interesting study that they did. There was one of the last conventions that occurred before we shut down in February. It was a biomedical convention in Boston. And at that time, there were about 100 people who got infected. And what they did is, this was a study that just came out fairly recently. They tracked, where those 100 patients, who they infected and how many people they infected. And it's thought that up to 330,000 people were infected from that initial cluster. So the actions that we take are very important, not just for us, not just for our families, but for other people around us. So staying at home, being safe, it affects a lot of people. So just realize that kind of the actions we take affects more than just us and our family. If we could have everyone mute, that would be great. So, in terms of some of the disparities work, I've given some lectures specifically on South Asians. We saw quite a big uptick in hospitalizations, infections and hospitalizations related to South Asians in Chicago after Diwali. And so we put together a slide deck where we were trying to target some of the community organizations in Chicago. But some of the slides I just wanted to share that are very interesting. Asians in general are less likely to be tested and more likely to die from COVID-19. So if you look at this graphic, basically, even though the hospitalization rate is 15.9, the death rate is 4.3. So for a given Asian person that's hospitalized, they're more likely to die. So that's an interesting thing as we think about kind of how does that affect our community. And then if you try to disaggregate, how many people, the different race ethnicity groups, and you look at South Asians are at higher risk when it comes to having a positive test and for being hospitalized compared to other Asian minorities. Chinese are actually one of the highest in terms of mortality. But for South Asians, this is an important thing. And some of the reasons why this is for South Asians is there's unequal access and barriers to healthcare and public health messages. And in the U.S., there's essentially two kind of high-risk populations. There's the population that's involved in healthcare, and there's a large contingent of healthcare workers in the South Asian population. But then there's also a large immigrant population. So there's fear around immigration, cost discrimination, cost and discrimination delays in terms of seeking testing and healthcare, and delays might lead to worse outcomes. And then common barriers to COVID prevention in South Asian communities include immigration status, language, occupation types, lack of personal protective equipment, housing, and intergenerational families. And then we all know that we are just at higher risk for some of the most risky kind of attributes that can affect severity of this illness. So diabetes, high blood pressure, and heart disease play a role in conveying a higher risk and a higher severity of the actual illness. So, before, we go on to vaccines, I want to say it's incredibly important that we continue to use masks, continue to socially distance. And, I'm seeing even on the list of participants, I'm seeing people wearing masks when they're outdoors. So that's fantastic. Monitor for symptoms and stay home. If you're sick, wash hands and stay home and avoid large and small gatherings. And, a lot of people talk about, I'm in this bubble and it's a small bubble. Your bubble is actually a lot larger than you think. If you think about all the connections that other folks in that bubble have, you can find that this bubble can extend for quite some time. So it's very important that you stay home and stay safe. And then even after the vaccination, you'll need to wear masks and consider distancing.
All the doctors are giving that.
Okay, so the next thing is treatment. So I wanted to talk a little bit about treatment because, for some period of time, we're still going to have a lot of infections. We're going to, they're still projecting a lot of deaths. So it's very important that people understand this. And I'm going to try to break it down, I'm going to talk about a bunch of drugs, but I'm going to try to break it down into what's really important. So a key thing is, about 80% of people recover from this disease without needing special treatment. And it's an important number. So most people actually do okay. And, aside from Tylenol or ibuprofen, they don't really need anything. But 20% of people require something. And so it's important to understand kind of what is it that's out there right now? What's the current state? So, if you or a loved one or a friend or a family member have end up getting COVID, you're well informed and you can make informed decisions and try to, get, the best therapies that are available. So right now, this is just a tracker for, what treatments are available. And you'll see that one is FDA approved. There's a few that are widely used. There's some promising evidence on a few, and then there's tentative and mixed evidence, for a few drugs. So this gets at some of the things that are widely used, and these aren't actually drugs, but these are interventions that people are using in the hospital. Prone positioning means just flipping over when you're laying on your belly when you're sick. And a lot of people ask me when they get infected, I just got infected with COVID, should I lay flat on my belly? So actually that doesn't actually offer much benefit if you're in an early stage, and I'll kind of talk about this a little bit later. This is really when you're in the hospital, this is important. So if you or a loved one or family member do get infected, this is not something that you should do at home. And then ventilators, you guys are all aware that they're that they're life-saving. So to kind of really describe, the different phases of this, in the course of infection, you have this viral phase where the virus is kind of, it's kind of growing and infecting cells. And then after that viral phase kind of dies down and the virus actually stops kind of, spreading. And you really have an inflammatory phase. This is the body's response to the virus. And that inflammatory phase can be even more dangerous than the viral phase. And in the viral phase, that's when you have the typical kind of flu-like symptoms, fevers, chills, muscle aches, GI symptoms. And the inflammatory phase is when you have problems with your oxygen status. And this is kind of the key point, the key set point. So if anyone gets COVID, really, as a physician, what I look for is, what is your oxygen status? Has it gone down low? And if it's gone down low, then that's important for us to know so that we can recommend that you go to the hospital because you're starting to enter this inflammatory phase. And so a lot of the treatments are, a lot of the treatments that we're looking at, we really think about it in these two phases. So the only study that has shown really an improvement in helping people live is actually steroids, dexamethasone and corticosteroids. And a lot of questions I ask is, as soon as a family member or a loved one gets infected, they ask me, should I be on steroids? Actually, steroids are dangerous if you get it before your oxygen status goes down. So if you're in that viral phase, that early state, then it could actually be harmful, and it could be associated with increased death. So it's very important that only if your oxygen status goes down should you be on steroids. And there have been a few studies that have shown that it's beneficial, and it actually reduces death by about 30%. So it's quite high. In terms of remdesivir, a lot of people have asked questions around that. That was the first drug that was FDA approved. I've been participating in studies around this. We're actually trying to set up an ambulatory study. The data is really mixed. So there is some evidence that shows that it reduces the amount of days that you're in the hospital. There was a big study out of UK which actually didn't show that it reduced days in the hospital, didn't reduce death. So this, it's very unclear as to what it is. So most people are not using this. I mean, some people are still using this, but the data is not completely clear. And there's active studies to see if we can actually use it very early on when people are in the viral phase to see if we can prevent people from being hospitalized. I included this because the whole treatment section, because I think this is important for everyone to know. So there's two drugs or two therapeutics that I think may show promise. There's convalescent plasma, which got emergency use authorization and probably got it a little too early. There is some data that shows that it may be helpful if you give this kind of convalescent plasma, which is really what happens is if someone gets infected, they produce antibodies. The antibodies work to kind of really target the infection and really neutralize it. And so if you take all those antibodies from someone's blood and you give it to someone, the thought is that this would help them and get better. And there's a lot of history of us using this type of treatment for other things. And so there's some studies that show that there may be some benefit, but it's not completely clear. Where we're really interested in looking at is if they're, if someone is infected and you give this, can this prevent them from getting even more sick? And so those studies are ongoing. We have actually a trial at North Shore where we're doing that. And monoclonal antibodies is basically taking one specific antibody from that convalescent plasma and giving that to people. The studies that have been done in people in the inflammatory phase have not really shown any benefit, but in the earlier stages, they're starting to show some benefit. So there's two drugs in particular. There's a drug from Regeneron, which has shown about a 50% benefit in terms of preventing someone from going to the hospital. And then there's a drug from Eli Lilly, which has shown a 70% benefit from going to the hospital. And the reason why I bring this up is because the government has bought out doses of this, and it's been distributed all throughout all the hospitals. And a lot of people don't know this, and there's been reports in the news that a lot of these drugs are available, but people aren't accessing this. So about only 20–30% of these drugs have actually been used, and they thought that this was going to be used immediately. So when I hear someone has been infected, and this, I've told at least 4 or 5 people in the last few weeks, if I hear someone has been affected by this, I tell them, go talk to your doctor and see if you can get access to this drug, because it is available at various hospitals. And while the data, most researchers will tell you the data is not sufficient for an emergency use authorization, there is a lot of promising data that shows it does reduce hospitalization. So if you or a loved one ends up getting COVID kind of in this period while we're waiting to get vaccinated, this is an important therapeutic that you can potentially access. So that's a very important point to remember, and they're called antibody treatment. There's 2 drugs that, I get a lot of family and friends ask me about these drugs from India, because these are 2 drugs that are widely used in India. One is called ivermectin, it's an anti-parasite drug, and one is called favipiravir, which is a drug used for influenza, primarily used in Japan, but it's being used in India. And so I have a lot of family members saying that they're being placed on multiple drugs as soon as they get infected. There's not really good data for any of this stuff. It's in the earlier stages. There may be some, there's some effect kind of in cells and stuff like that, but they haven't really done active clinical trials yet, or the data isn't there yet to know if it's beneficial or not. So in the event you have family members, loved ones in India that get sick, you'll hear that I'm on a bunch of drugs. These may be some of the drugs that they're on. Not clear data that this works. There's been a lot of drugs that we have tried in the US to, around the world, try to test out, that have shown some benefit in the test tube that really haven't ended up working out. So my suspicion is these probably will not work, but these are being given around kind of all over the place, especially in India. So now the bulk of the presentation is really on vaccines. And I think this is, we got an overwhelming number of questions really honed in on vaccines. So this is at the top of mind for everyone. And I'm hoping to kind of take you through a lot of the questions that you guys have kind of ahead of time. And then obviously we can, go through kind of the specific questions you may have after this. So I'm sure you guys all know Anthony Fauci. He's been in the news. He's been kind of one of the coronavirus task force members. an incredible gentleman, and he said that I feel extreme confidence in the safety and the efficacy of this vaccine. And I want to encourage everyone who has the opportunity to get vaccinated so that we can have a veil of protection over this country that would end this pandemic. There's a few things in here that I think are key. And speaking to, I've heard Anthony Fauci speak for many years as I've gone to kind of our ID conferences and stuff. And really his focus really is on vaccine development. And, he's the leader of our NIAID. He said that he has extreme confidence. There's safety, there's efficacy. He wants to encourage everyone. There's a veil of protection offered from this, and that this may end the pandemic if we take this in high number. So these are some key points that I think that I want to kind of focus on, specifically related to kind of the vaccine. And this is something that, a lot of healthcare workers are also stressing to communities. So this is just a coronavirus tracker. So there's a lot of vaccine platforms that are up, kind of in various stages of safety trials. And there's various safety trials. There's phase 1, which is small number of people, phase 2, which is hundreds of people, phase 3, which are thousands of people. And you see that there's kind of a long line of vaccines that are slowly making their way. There's 3 that are approved, there's 5 that are limited, and then there's a bunch of trials that are actively going kind of in phase 3. So the leading vaccines, the ones that really are in the news, are Pfizer and Moderna. They're approved for emergency use in the U.S. and there's various other countries that have approved, a handful of different, vaccines. And this is even slightly delayed. And updates to this even in the last few days of various countries kind of approving this. More than 1.1 million people in the U.S. have already gotten a COVID vaccine. This kind of shows where the penetrance of the vaccine is. You'll see that in general, every state has had some access to the drug, and they're starting to vaccinate. There's certain states that, there may not be full reporting, but the rollout has been a little bit slow given the complexity around the types of vaccines that we have. But we'll see that this will start picking up, fairly quickly now. To give you an idea of just kind of the basic science behind, what a vaccine does, so you provide some kind of target that your body recognizes as foreign. And then what happens is there's certain cells in your body that produces these proteins called antibodies. And what happens is the antibodies bind to the coronavirus, and it prevents it from entering into the cell and infecting other cells. So this is the coronavirus. These things are called the spike protein. This is really what every vaccine, what every antibody treatment is all targeted this one protein. It's called the spike protein. And so the antibody binds on that. And when that happens, the coronavirus can't stick onto your cell and deploy its genetic information into your cell to infect your cell. And so that's really kind of the basics around, what these vaccines are doing. It's producing the antibody response. So there's multiple... I'm sorry, if you guys could mute, that would be fantastic. So there's a variety of different types of vaccines. And, when I showed you all the vaccines in the various states of approval, you saw that there were, genetic vaccines, protein-based, viral vectors, whole virus vaccines. The key one to note is really the genetic vaccines, because those are the two, Pfizer and Moderna are really genetic vaccines. And what it is they are basically putting a little bit of the RNA, which is the genetic material from the actual virus. So they create a synthetic mRNA. So it's not from the actual virus. They create it because they already know the sequence. And they put it in this fatty kind of, they call it a nanoparticle. So basically a fatty kind of envelope. And that's what they inject. And so what happens then, and I know that this is a little complicated, but just to simplify it. So when they give you the vaccine, what happens is the genetic material goes into your cell, and your body actually looks at that genetic material, and it basically, its own machinery starts producing the protein, that spike protein. And that spike protein then is basically looked at by your immune system, and there's multiple different cells that look at it. There's the cells that produce antibodies, which are the B cells, and that gives you the antibody response. But what's also important to note is there are other parts to your immune system that are also looking at that and are also present and also recognizing that this is a foreign particle, and it's these memory T and B cells that are also providing some immunity. So you'll hear that, that some of the, the antibody wanes after a few months. What's important to note is your body still has some recognition of this in these other types of cells, okay? So to talk about, I know there's a lot of questions about the Pfizer and the Moderna vaccines. And I think this is being recorded and it'll be available, so you can look at this. And then, also if folks are interested in this slide deck, I can provide it as well. I'm not going to go into the details of this, but what we know so far from the 2 vaccine trials, they're stage 3 trials, they were done with very good science. They had about 20 or 15,000 patients who got the actual vaccine, the 2 different vaccines, and the same amount of people who were in control. And what they found is that the vaccine efficacy, meaning the likelihood of preventing, kind of a symptomatic infection, was very, very high. So around 95%. 95%, to give you some context, is about as good as we can get with a vaccine. There are some vaccines like measles and polio, which are, 95, 99%. But to give you kind of context, the flu vaccine is usually somewhere between 30, 40, 50%. So it's quite low. So this is actually, I think this is kind of a modern miracle that, this happened. When the scientific community was looking at these vaccine platforms, and they were trying to decide when we would get, what would be the threshold for giving approval. We set it at 50%, thinking it might be, 40%, might be 60%. And this just kind of blew through expectations. And part of that is because, that spike protein is a very kind of immunogenic, meaning it creates a really strong immune response. In terms of the side effects, I know a lot of people have questions about the side effects. There are some side effects from this. What we found is that there were frequent non-serious adverse events. So the local reaction, sorry, people are trying to annotate the shared content, and I'm so sorry, it just keeps popping up. So there's some frequent non-serious adverse events, such as local reactions and systemic symptoms like headache, fever, and fatigue. And they're reported within a few days of each dose. There have been really non-fatal significant adverse events were the same in both, meaning it was no different whether you had it or not. And they just record anything that's related, anything that's considered severe, whether it's related to the vaccine or not, they record it. And so all of these things were essentially not really, recorded. None of these things were really caused from the vaccine. The deaths that occurred from, both vaccines were not related to the vaccine. So they just monitor everyone, they record everything. So really the main things that we're talking about are really the local injection pain, swelling, redness, and then you see these systemic side effects, the fevers, the chills, the muscle aches, the headaches, the fatigue. Really what that represents is your body is creating an immune response. So, the more robust that response, the more robust those side effects, the better your immune response is. And it's kind of hard to get away from that because that's really your body telling you that it's seeing some kind of foreign invasion and it's reacting to that. So that's literally what it is. The Moderna vaccine may have a little bit more in terms of these side effects, and none of these things have serious side effects from these studies. And you'll see, we're tending to see that there's more side effects after the second dose. Most people who get the first dose say that they have a little arm pain, maybe a little fatigue, but they all feel fine. They all feel great. I know because a lot of my colleagues have gotten the vaccine. They all feel great. They're all feeling happy about it. And it doesn't matter if you're old, if you're young, if you're on insulin, if you have heart disease, if you have any of these things. It's all, it's all the same. The immune response is, essentially the same. There are a few groups that haven't received this: pregnant, lactating, immunocompromised. So these are groups where, and children, obviously under 16 or 18, depending on it. So there's a couple groups that haven't received this, and those studies are actually underway for children and for pregnant women to kind of understand that. But were some pregnant women who received the vaccine. And generally, it's thought that it should be safe for pregnant women, and the vaccine provides, efficacy in pregnant women, and it provides efficacy in the, through the placenta to the children that are born for a few months as well. And then the Pfizer vaccine, 21 days apart, Moderna, 28 days apart. There are a few additional things that I'd like to talk about. Well, I'll get into it in a little bit. Well, might as well talk to you about this right now. There are a few other side effects that have been brought up and that are in the news. One is Bell's palsy, which is essentially, it affects the facial nerve. So you can have drooping of one side of the face. And that occurred in about 1 in 10,000 patients, subjects in these studies. What that represents is, without the vaccine or anything like that, in the US, we have a certain number of Bell's palsy, and that's at a rate of 1 in 10,000. So whether you get the vaccine or not, there is a kind of a rate of Bell's palsy that exists, and it's probably no different, maybe a little bit higher with the vaccine or without the vaccine. Bell's palsy in general gets better in 80 to 90% of people within a certain number of weeks or so. So this is a rare, I would say, a rare kind of side effect, and it's unclear whether the vaccine is producing more of it or than a normal if someone who doesn't get vaccinated. The other thing that I'm going to talk about is in a little bit as well is the effects around the allergic reactions. Allergic reactions so far have occurred in 6 people with the Pfizer vaccine, as far as I last checked, and then 1 person with the Moderna vaccine. Over 1 million people have been vaccinated, through, since this has been rolled out. So that means that's about 1 in 100, 150,000. And all of the people that had the side effects were people who have serious allergic reactions, either to vaccines, to, like shellfish, or to other components that they've had anaphylaxis for, that they carry EpiPens around for. So that's another big side effect that's kind of coming up in the news. But beyond that, really, with a million people who have just started getting vaccinated and the 30 or so thousand people in the study, there really hasn't been much in terms of side effects that we've seen beyond the kind of immune response. This is a graphic that is widely shared in clinical, circles, and it basically shows how effective the vaccine is. So there's 2 groups of people. This was the group that received the Pfizer vaccine. This was the group that did not receive it. And this is how many people actually ended up getting COVID. And you'll see that there's a kind of a straight line of people, if you're in the placebo arm and you didn't get the actual vaccine, who ended up getting COVID. And then what happened is in the vaccine arm, you see that it's pretty similar for the first about 10, 14 days, and then there's the divergence. And then you see that people still did get COVID after they got the vaccine, but at very low numbers. And so this is where they got the 95%, efficacy in terms of preventing, symptomatic infection. So one thing to note is if you get the vaccine on day 1, you're not really in the clear for some time. And really what we're recommending is wait 2 weeks after the second dose, whether it's Pfizer or Moderna, before you have that protection. And even after that protection, you're still going to have to use those mitigation efforts of masks and social distancing and all those things. You can at least sleep rest assured that, essentially no one had a serious infection after having both of these. But it's still not clear whether you can still pass the virus. There is a suspicion that with Pfizer, you may still be able to pass the infection on, its mild state. And even in Moderna, you can pass it on. But it's not clear that with Pfizer that you're actually blocking the virus from being passed on. Moderna, there's some thought that you might be able to block. There may be some early indication that it may prevent actual spread of it, but it's still early, and the data is we're still trying to figure that out. So components of the vaccine, to understand, kind of what is in this vaccine, there's usually only 10 things or so that are in both vaccines. There's the active ingredient, which is the synthetic mRNA. That's the genetic material. There is mRNA floating around in our body from all kinds of viruses and bacteria at all time as well. And that basically, this is not something that is, completely, there's no way that this is going to, integrate into our system, into our genetic material and cause kind of long-term problems. These things get degraded within, 24, 48 hours, as does all the mRNA that's in our body from kind of other things, that are floating around. So that is a fairly safe component, and really just produces that spike protein. It doesn't produce the actual virus itself. It just produces one protein. Then there's a bunch of fats. There are a few fats that are there. I put in bold and in yellow this polyethylene glycol. They're starting to think that maybe some of the immune reactions may be related to polyethylene glycol. That's a common drug that's used in colonoscopy preps and in this drug called Miralax, which is for constipation. So there's thought that some of the immune reaction may be related to this polyethylene glycol. Then there's a bunch of salts, buffers, and acids, basically to turn this fatty nanoparticle into a nanoparticle that is similar in nature to our own kind of, our similar lipid membranes, our fatty membranes that we have in all our cells. So it's just basic salts, and then there's a little bit of sugar. So these are the main components of this. In terms of if you have an allergic reaction, a bunch of people have asked me, I've had an allergic reaction to this or allergic reaction to that. Well, is this safe, right? So again, to understand, the number of people who have had anaphylaxis, meaning they've had a really serious life-threatening type allergic reaction, is only 7 out of over 1 million people. So it's very, very low. It's on the scale of 1 to 100,000 or plus. And the CDC has basically put together some guidelines as to what to do. And I just like to kind of go through this. So may proceed with vaccination if you're immunocompromising pregnancy, lactation. Remember, I said these drugs were not tested in these patient populations, but we suspect that these patient populations will be totally fine in getting it. Really, in terms of immunocompromising conditions, we're not sure if the immune response is going to be as robust as someone who doesn't have the immunocompromising condition. So, when we say there's a vaccine efficacy of 95%, it's not clear that that's the case for the immunocompromising conditions. In terms of pregnancy and lactation, I kind of described that it's it's going to be safe. It's just we just haven't studied it in those populations. And then additional information provided. And then they say basically provide some additional information. And for every patient that comes into the hospital that's getting vaccinated right now, there's always a 15-minute period where we watch to make sure that these patients don't have some kind of reaction. And then if you have a history of food, or other types of allergies that are not related to vaccines or injectables, you're okay to proceed. History of allergy to oral medications, okay to proceed. Non-serious allergies to vaccines or other injectables, so not anaphylaxis, which means that your throat swells up, your tongue swells up, you're okay to proceed. If you have a family history of these types of things, you're okay to proceed. And any other history of anaphylaxis that is not related to a vaccine or injectable therapy, you're okay to proceed. But we may lengthen it to, instead of 15 minutes, 30 minutes to make sure that you're okay if you've had a severe allergic reaction. And then if you've had moderate or severe acute illness, again, whether it's diabetes or, heart failure or, hypertension, 15-minute observation period of vaccinated. And then history of severe allergic reaction to another vaccine or to an injectable therapy. Again, there's a precaution to vaccination, again, 1 in 100,000, and there's a 30-minute observation period of vaccinated to watch out for. It's if you've had a severe allergic reaction to any component of the mRNA COVID-19 vaccine, whether it's PEG, that I mentioned, or the actual vaccine itself, that's when we basically say that's a contraindication to vaccination. All right, so now a little bit about the immunity. So if you've been infected, how long does this last, and does this potentially translate to the vaccine? So the thought is that whether you get the vaccine or you get infected, the immunity is going to be potentially pretty similar because you're still targeting that same kind of protein, and it's the same mechanism of immunity from your immune system. So these were 2 studies. One study was out of this big journal called the New England Journal, which is one of the main journals that we have. And and this was some time ago, they basically said that at least 3 months, for at least 3 months, we're seeing that patients still had these antibodies being produced. And then there was a more recent study that just came out last month where the immune system is producing antibodies as far as 7 months out. So the question is really like, if I get this, am I immune? It seems that in general, for most people, for at least up to 7 months, as far as we know right now, you have antibody production that will neutralize the virus. Does it necessarily mean you're immune and you can't get the virus? There are case reports, meaning there are a few people who have actually gotten the virus twice. It's not completely clear if that was related to, some false negative testing or false positive testing and, getting the virus twice. But the suspicion is that, in some folks, maybe with poor immune systems, it's possible that they could have gotten it again. So, when someone asks, are you immune? You'll see a lot of physicians say, technically, you're not really immune. It's not like, like polio or measles, where there may be some, at least for a long period of time, essentially lifelong immunity. Here, the suspicion is that this will last maybe about a year, maybe a little bit longer. When we think of other coronaviruses, when we think of SARS, which had a 10% death rate, so not like a 2-3%, which is what we're seeing with coronavirus, with COVID. The immunity lasts for years. With normal coronaviruses that are circulating, like cold viruses, the immunity lasts for a few months. So we suspect this is somewhere in between years and a few months. So we're thinking that this may last for at least a year or longer. But it's still, there's not enough time that's elapsed since this first started for us to really know. But at 7 months, I think, is probably where the literature says where this will occur. And the suspicion is that this will get longer as we study these people longer. And then the suspicion is that if you get the vaccine versus the infection, that the same immunity will last. So herd immunity, a lot of people ask, herd immunity, when are we going to get back to normal? And it's really tied to this concept called herd immunity. And, herd immunity really refers to the indirect protection from infection conferred to susceptible individuals when a sufficiently large proportion of immune individuals exist in a population. So it's, I get vaccinated, and because I'm vaccinated, I prevent the spread to other folks. And if you have enough people who are vaccinated or who have had the infection, then you'll be able to stop the spread of the infection. Kind of like what we did with Ebola. You get enough, well, if you stop it, eventually it'll kind of peter out, or at least it will slow down. And so it's tied to a few things. It's tied to infection, the vaccine, and it's tied to this kind of concept called the R0, which is how transmissible is COVID, is coronaviruses. There's certain things that spread like wildfire, like, measles, maybe even coronavirus. There's certain things that don't spread as fast, such as flu, Ebola, etc. And so really, it's a bunch of these things that affect herd immunity. And so I wanted to take a moment just to explain this and to explain why us getting vaccinated is so important, because it not only protects ourselves, but it protects our family members and our community at large. So if you have a population, the blue people are people who have never been vaccinated or infected. The red people are someone who's infected, and the yellow people are someone who has immunity. And so if you look at this, if you have one person that's infected and no one else has this spreads across the entire population, and you'll see that, maybe one person is left unaffected. But if the same person comes into a system where a bunch of people are infected, you see that maybe only, one person gets infected, and all these other people are preventing all these people that are not infected, that are non-immune from getting sick. So that's what this concept of herd immunity is. And you probably have heard, in the news, or Anthony Fauci say it's, maybe, like 60 to 70%. Where they think about that is related to this kind of this R0 concept that I mentioned, which is really how transmissible something is. And so this is kind of early data, but COVID-19, the R0 was this number around 2 to 6. And so they thought that what is the rate of herd immunity? Somewhere between 50 and 80%. So that's kind of where those numbers originally came, where Anthony Fauci said it's probably like 60, 70%. If you follow the news and you follow the coronavirus task force and Anthony Fauci closely, you'll see that he's been upping that number. So initially it was like 60%, then it was 70%, and it was 80%. He's now saying that ideally if we can get up to 90%, that would be good. And that's partly due to the fact that partly due to the fact that, initially there was a lot of vaccine hesitancy. The vaccine hesitancy, about 50% of people said they did not want to take the vaccine in the summer. And then as we get further and further down, as people are taking it, we're seeing that vaccine, people around 60, 70% of people, there was one study that said about 70% of people said they're interested in taking this vaccine. So he's been slowly going up on that as people are more, accepting of this coronavirus vaccine. And also because there are some things that I'll talk about a little bit later that are hinting that the spread might be occurring, might be accelerating. So that's part of, herd immunity. I've gotten a bunch of questions about this. So how did they develop it so fast? And are you concerned? So there's a couple reasons why this has developed so fast. It was thrown out that vaccines take about 10 years to occur. And that's what happens traditionally, with most diseases. But there was a confluence of a lot of different things that occurred kind of simultaneously that has resulted in us speeding up this process. And so warp speed and, kind of the political stuff aside, the scientific community has been working on this for some time. So while COVID-19 didn't exist, but a year ago, there are similar viruses in SARS and MERS, which is called Middle Eastern Respiratory Syndrome. And these viruses, as soon as they came out, a lot of companies started trying to develop vaccines. And so they started doing that. But then what happened is SARS and MERS kind of burnt out. So the vaccines didn't continue, but that knowledge accumulated. And so we understood how to kind of target coronaviruses. There's this group called CEPI, which is the collaboration, and I'm going to butcher the exact letters, but is epidemic preparedness innovation or something like that. And it's a group that's gotten together. It's NGOs, pharma, governments to kind of figure out how to rapidly develop a vaccine in the case that we have a pandemic that occurred like this, that just blew up and affected everyone in the community. And so they've been working on figuring out how to speed up this process, and that started in 2017. I've gone to ID conferences where they've been talking about this, and that this kind of partnership and all this infrastructure is being built in order to do this with the next pandemic that occurs. Other things are concurrent production. This doesn't happen ever. You never see a vaccine being developed and being produced simultaneously and being tested simultaneously. This was done because we were willing to take that high risk. If the vaccine didn't end up turning okay, we would have basically, all that production would have gone to waste. But we were extremely lucky that it not only was very efficacious, but highly efficacious. So there's a lot, and that high rates of infection. In order to do the stage 3 clinical trial, you provide someone with a vaccine and you wait to see if people develop the infection and see if they got it or didn't get it. Right now, with the current rates being as high as they are, in our summer wave and stuff, when these studies were happening, it happened so fast that these studies started and closed so quickly because of that. And then obviously there's genomic advances. We don't, when the virus first occurred, the Chinese basically created the genomic, they basically defined the genome and sent it out. And so we knew exactly what the genome was. So we typically, before these genomic advances, you'd actually have to get the virus and then you'd have to actually grow it and do all this, but we're not in that age anymore. So are we sure these vaccines are safe? I basically spoke to kind of the short term. A lot of people ask, long-term issues, are there anything that exists? We've already looked at, a few months down the road, are there any long-term issues? Aside from the Bell's palsy, which can, affect you for, a few weeks. And again, it's not clear that that's at a higher rate than in the normal community. We haven't seen any long-term side effects. In terms of this being an RNA versus a protein, there is nothing that, any immunologist or ID doc would basically tell you, there's nothing that this mRNA will do that will integrate and cause kind of an immune condition or something like that. That is as far as we know. So we obviously still have to wait, but we've now vaccinated, 1 million people. By the time folks get vaccinated, we'll have, a bunch of data as well. Are we worried about, I basically, just answered that question. So then should I worry about which one I get? Pfizer and Moderna, essentially the same platform. Moderna has a little bit more in terms of side effects, but really if you're offered something, I would take this as soon as you can. And it doesn't really matter which one. They both are highly efficacious. 94, 95, that's essentially the same thing in my book. And it's really the same thing because they have the same design. The drug is essentially, the vaccine is essentially the same. All right. So now this is something I put together because a lot of people tell me I'm not interested in the vaccine because there are so many side effects. So I think the way to think about this is if you look at just the side effects, obviously you don't want to take something with side effects, but you got to look at what are the effects of COVID and you have to balance out this. This is a cost benefit analysis. The vaccine has 95% efficacy. There's no serious infections or death. 2 to 10% develop symptoms that last 1 to 3 days. It protects yourself. It protects your family. It protects your friends. It protects your community. It protects your country. And with eventual herd immunity, this will result in us getting back to normal. So now what happens if you don't take the vaccine? Around 1 in 200, 1 in 300, you know, it's unclear what the exact rate is, but 1 in 200, 100, 300 end up dying. Right? So you're comparing a side effect to a high risk of death. There's a risk of hospitalization, ICU, ventilation. The symptoms last 1 to 2 weeks. They are not good symptoms. They are, not, for some people they may be asymptomatic, but for the people who are symptomatic, even if they don't get hospitalized, these are not pleasant symptoms. They can last a few weeks. There is this long hauler syndrome that exists where people have this mental cloudiness and fog, persistent fatigue, persistent stuff related to their heart afterwards. You put your family, friends, community at risk. Pandemic living, which is, we have to continue wearing masks. We can't see our loved ones. All the, mental, behavioral, social related stuff that occurs as a result of the pandemic living. So, I mean, when I look at these, it basically seems like a no-brainer. We're starting to get a lot of data. The people who are being vaccinated first are the healthcare providers who understand this the best. And I can say that my entire Facebook post as I was going through were family members and friends getting the vaccine in complete joy, all physicians. Dr. Nitin Shah, I don't know if you're on mute, but I understand you just got the vaccine. Could you just speak to kind of the, what's going on in California and what people are, how they're feeling and how you're feeling really?
Yes, thank you, NIRAV. My vaccine yesterday at 12:45 p.m. and I did feel fine until about 10 p.m. at night and started getting little pain and little chilly feelings. I did not take any medicine, just went to bed. And when I woke up a few hours later, I was feeling better. So I did get some reaction, as you explained, that it does do something to the body. I don't know whether less is better or not, but at least I did not have any other symptom and I'm feeling fine now. I do have little pain at the injection site, but that's about it.
Can you also speak to kind of in your hospital how people are feeling to get the vaccine, like your colleagues and stuff like that?
Yeah, it has been a challenge amongst some of the nursing assistants, especially. All my colleagues, I'm an anesthesiologist and an ICU doctor, and we are all ready. Our hands are ready for the vaccine. They've been ready. But some of the nursing assistants, I was very curious that I was sitting in a lunchroom and they were talking and said, no, they don't want to take vaccine. So this was about 10 days ago. So when I started probing it further, we did discuss and the answer was, oh, I don't know why I don't want it. I said, can you explain me the reason? And they, of course, couldn't. So when we went on further discussions, they all said that, yes, we're going to sign up. We're going to take the survey. I literally hope that they would have said yes. I don't see any reason not to take unless you are really, you have severe allergies, etc. But other than that, there's no reason not to take the vaccine in my opinion.
All right, thank you. I know we're getting close. I'm getting close to the end. So when will I get vaccinated? So they created 3 tiers, and this is actually one of the most complicated decisions, trying to figure out who to get vaccinated. There was a great New York Times article where they described all the complexity and ethical issues. And it's really this balancing act between those at high risk of death, those at high risk of catching COVID, and those required to maintain critical infrastructure. So 1A is really healthcare workers and residents of long-term care facilities. That's about 24 million people. Phase 1B is COVID-19 vaccine should be offered to persons age greater than 75 years and non-healthcare frontline essential workers. That's about 49 million people. And phase 1C is to persons age 65 to 74 years and persons age 16 to 64 years with high-risk medical conditions and essential workers not included in phase 1B. That's 129 million people. So that's about 200 million people. So when are the doses actually coming, and when can you potentially see it? So we've already started the Pfizer BioNTech vaccines. That's 25 million doses. Remember, 2 doses per person. So that's 12.5 million people. Then there is Moderna, which is 20 million, and that also they're starting to do. And these are deadlines. So it's going to be given on a rolling basis, but these are deadlines. And then you see that there are about 400 million vaccines that have been ordered. So for 200 million people in all those different groupings as well so far. And that, includes points of deadlines in March, in June, and July. So the thought is that by July, hopefully the majority of, anyone that is interested in a vaccine, we're hoping that it's everybody gets vaccinated. And also the pregnancy and pediatric trials are going, so we're hoping that that happens as well. So just a quick thought on variants, that a lot of people are, a little worried about what's going on in England and South Africa. There was a variant, this is a non-peer reviewed study where they looked at it, and what they basically found is that they estimate, based on doing some modeling, that the virus itself, these variants, meaning they're mutated versions of the normal coronavirus, maybe 50 or 70% more transmissible, meaning it spreads a lot faster than normal. And so they're not able to understand that they're not finding any evidence that it results in more severe infections, but that it's just more transmissible. This information we're going to find out more and more as we go along, and it's related to just some of the mutations that exist and how it affects the ability of the virus to latch on to the actual cell in your body. And there's some mutations in, in the spike protein, which people are concerned, is this going to affect, sorry, my child managed to run up to come here. So there's some mutations in the spike protein, and there's concern that could this affect the efficacy of the vaccine? It's not clear yet. A lot of people are saying, based on where this is located, that it probably won't affect the efficacy. Some people have said maybe it might reduce it a little bit, but it's still very early and people are testing this. Either way, if this efficacy is affected, these different companies, Pfizer, Moderna, they can turn around these new variants within 6 weeks or so. All right. And then in South Africa, they've noticed that there's a separate variant results in a high viral load in the nasopharynx. So it's similar to this UK variant. So with that, I think I'm done and we can take questions. Sorry, my child is playing games in this room. Can you?
Maybe you can mute.
I'm going to mute myself.
Thank you. Thank you very much, NIRAV, for this wonderful information. And I would like to give names of all the people first who have taken time to ask questions. I will not be associating questions with all of them, just in the interest of time, because some of your questions are already answered. But if you still have another one or something, you can certainly send a chat. By the way, I'm Dr. Nitin Shah, as Hemant Bhai had said before, and I'll be the host to get questions and answers. And I also happen to be a physician, anesthesiologist, and intensivist, so I may have answered some of your questions, or I may continue to answer some questions. So people who have taken trouble to ask questions are Kanti Gangar, Bindu, Manish Bhai Mehta, Trishula Brahamai from Bangalore, actually, Pramod Shah, Hemendra Bhai Mehta, Jatin, Dr. Kavita Kajuria, Meena Mehta, Jatin, I said, and there were few which came on Jaina without the names, and Gitas is another family who ask questions. Now, going into the questions, I think, Kantibai, I assume that you got all your answers. There are not really serious and permanent reactions. You take vaccines twice, Pfizer in the interval of 21 days and Moderna in the interval of 28 days. Distribution of vaccine and cost, that's a question. Nirav, if you have any answer.
Yeah, so the government has already bought out the vaccine. There may be, so there is a cost associated with the actual, the nursing cost to deploy it, but insurances are waiving it. And so essentially no one is going to pay for these vaccines. It's just, they're trying to recoup it through insurance, that just deployment cost. But no one should pay for these vaccines. They've already been paid for.
Great, thank you. Dr. Manish Mehta had questions about Jain-based and other religions. Vegan, all our ingredients are known to be vegan, and also what would be a Jain perspective. And then he also mentions about Muslims and Jews. They are concerned, and it's considered, or they've declared it as halal, but any insight into whatever you know?
Yeah, I'm going to try to take this question. This is a complex question, and then Dr. Nitin Shah, I'm going to ask to get your thoughts and wisdom on this as well. So the actual vaccine itself, I gave you the components of it, right? But the vaccine is tested on animals in the preclinical phase. So there is a component of animal harm kind of in that stage where they're testing it on animals to see if they develop coronavirus. And then for pretty much all vaccines, they use animal products essentially for certain components, just because it's widely used. So so that exists kind of for coronavirus vaccines. I think there are some products that are being used. I do have to state that I can't. This is not a mandatory vaccine or anything like that. And I shared some of the results of some of these studies to kind of explain that, you getting vaccinated not only protects yourself, it protects your family, it protects your communities, it protects your country. Obviously, everyone is going to have to make their own kind of judgment on whether they're okay with that. But, given the nature of this pandemic, how severe it is and how it is, ripping away our loved ones, this is, it's a very difficult question to answer in terms of kind of what's the position of, Jaina and, from a religious standpoint. But it is the one tool we have to get back to normal and to protect ourselves.
Yeah, I don't think I have any other add individual decisions. I don't think a lot is known except what Nirav said just now, that there is animal, for the lack of better words, I would say, is involved, and we all will have to make our own calls in terms of whether we want to take it or not. And it will be a while before when really the religious discussions and comments will come out. For now, I think the safety of the world is really key, and we all should consider taking it, will be my recommendation. But of course, we all will make, is it an absolute Jain thing? Probably not. So you just have to make that choice. Okay, I'm going to start answering some of the questions, and Nirav, please feel free to jump in if you think that I'm not catching up right. Pramod Bhai asked about okay to take vaccine for diabetes, on insulin, elderly, heart ailments, lung ailments. It's good for those people for sure. For elderly also, will the outcomes be better for elderly? Yes, they need to protect ourselves. It is probably similar to, we all always recommend that elderly and people with other medical conditions should take the vaccine of flu and measles, etc. Same philosophy here as well.
I have one point to that. They studied the vaccine efficacy in elderly and young people. Vaccine efficacy was the same in all age groups, essentially. So that's another thing that's important.
Sure. And then a question from Hemendrabhai Mehta: if he's on a phase 3 trial of J&J, should he take vaccine if it is offered in the hospital? And what I answered is investigators of J&J trial rather than you or me telling anything. Okay, Hemendrabhai, so that goes. Which vaccine do we recommend? Whichever one you can grab your hands at. Vaccine prevent Yes, if the patients are asymptomatic, but they are carrying it, they get the vaccine, will they not transmit? I think you probably need to help me answer that question.
It's not clear. The suspicion, I mean, people are still getting, they're still getting infected, but they're not getting seriously infected. They're not going to the hospital. It's not clear that that this is going to stop transmission. The thought is maybe with Moderna. They're not, I don't think they're seeing that with Pfizer, but in general, it's not clear yet. We're still waiting on data.
Meena Ben, the vaccine on Wednesday, they felt a little fogginess on Friday. They are better now, lethargy, etc. But 2 questions: are there any neuroscience side effects? I think you addressed by saying Bell's palsy is the only thing that we know. But then other thing is there a booster dose that we need?
Is there a booster, meaning after the 2 doses?
Kind of, yeah.
Yeah, so I mean, the thought is we're not sure how long this, the ability for this vaccine and the antibody production to prevent kind of this serious COVID. It might be a yearly thing. It might be, you know, a few years. That's not clear yet. As we get further into this pandemic and we learn more and people, you know, we understand how long the immunity lasts, we'll have a better understanding of that.
Right, that's the answer about future vaccines, also how long it will last. Risk for people with asthma, sure, you should take them. Side effects are more with the second dose. I think NIRAV did explain that. Vaccine and new mutant strain, do we know anything at this point?
Too early. They're studying it. There is kind of mixed messaging so far, meaning they don't really know. The person that's the head of Operation Warp Speed says they don't think it's going to be the case. Other researchers have said they don't, based on where the mutations are, they don't think it's going to affect it. As they study more, they may find that it might decrease it a little bit or not. It's not clear. But this is one of the few strains that has a lot of different mutations to that spike protein, but they think it's not going to significantly affect the efficacy of the vaccine.
Right, and Geetas are commenting that why are we slow to vaccinate? Why don't we do 24/7 and give it? I think that's a tough question. We will take it. But
it's tough. I mean, if you think about, in order to distribute and vaccinate, you have to have the right kind of cooling systems in order to do that. So only a few places have that actively, and they were preparing. I think Walgreens and CVS are getting geared up to do that, so they have to get the manpower and to get this. I think this is going to rapidly start occurring, right? They're trying to get, you know, the faster, you know, I showed you that graphic, the faster that you vaccinate, the more people you save. So the goal is to get this out as fast as possible. The question is really like, you know, can we build a supply chain for all the cooling and everything like that, and get the people interested in order to get that set up. There is also some complexity because you have to come back for a second dose. It's not like the flu shot, you get it and you're gone. You know, you have to come back, which makes it a little more complex.
Dinesh asked a question about US government has any system when seniors will get vaccination. Is government will inform individuals? Is the idea?
Yeah, that's a good question. I'm not sure. I'm sure there's going to be a public awareness kind of campaign. You know, I showed the various tiers, right? So so tier 1A is really people in nursing homes. 1B is if you're over like 75 years of age. And then 1C is really kind of all the other elderly people. So it's probably going to come in waves. They're probably going to start, you know, just based on when the doses line up. It may be like February or so where they start 1C or something like that, and then they start vaccinating that until July. So that's my thought, but we'll have to see kind of how it goes, and you know, we'll have to get the appropriate messaging from government to understand that.
Someone asked, if you had COVID infection, should you take the vaccine, and when?
Good question. So right now, the recommendation from the CDC is, you know, you can theoretically take it after about 3 months and you're probably okay. Obviously, the vaccine manufacturers are like, even if you've had it, you can take it. It's not going to adversely affect you, but it can provide a booster. So that's something that you can look at. Generally, over 3 months, if you have access to it, you can get it and you'll be safe, and it may produce a boost in the immunity.
Puspa Dosi is asking, a person who gets vaccinated can spread the virus between the first and second dose of vaccine?
You can get I know of someone who got the first dose of vaccine and got it, right? So like I mentioned, you're not 100% safe, or I mean, you're not 95% safe until 2 weeks after the second dose. So in that period of time, you have to still be very careful. So, the injection itself is not what grants you the immunity. It's your body's response to that.
Santi Mohanot is asking, if both are similar, why Pfizer's needs?
Right. I think that has something to do with the lipid nanoparticles and the salts and everything, buffers and stuff in it. So it's not I'm not sure exactly why beyond just kind of the capsule that it's housed in, the mRNA is housed in. It's just different, and because of that, it needs some cooling to maintain its integrity.
An interesting question from Bangalore from Trishla Brah. Or what, that some people get infection, don't have symptoms. Somebody in the family gets it and passes away in 1 or 2 days. Is there any reason? Is it?
So
Somebody froze, Nira. Nira, you were frozen.
Sorry, can you hear me now?
Yeah, yes, we can hear you.
Okay. So really, why do we have different responses to the virus in different people? And this is something we see with all viruses, all bacterial infections. Coronavirus is unique in that you can have asymptomatic to deathly ill, just in the same type of person, two people and they look the same and they have the same issues. It can happen. There's generally three things that I think about for all of these viruses and bacteria, et cetera. One is it's the host factors. So what kind of conditions do I have that puts me at risk? Do I have diabetes, hypertension? Am I immunocompromised? The second is the virus factors. There's a lot of variants going around, right? Some may be a little bit more deadly, some may be less deadly, severe, less severe. We just don't know because we're not doing genomic testing on everything. There's also the amount of virus that you actually get infected with. If you get infected with more virus, you can have a more robust response to it. And then the third thing is really the interaction between yourself and the virus. And there may be some genetic components to that. There are other components to that. How inflammatory of a response are you going to produce to the viral infection? So those three things are really what I think, and it varies from person to person. So that it doesn't look like there's any rhyme or reason why someone is asymptomatic. Your partner is asymptomatic and you're deathly ill. But it's some combination of those three things.
Great. What quantity? 0.5 ml, right?
Yeah, I think it's 0.5, and then they found that actually these vaccines are coming with around 0.6, 0.7 ml, so that they're actually able to vaccinate more people than they thought initially.
Yeah, a private question to me, so I won't mention the name, but if you can answer. An anaphylactic reaction, somebody had anaphylactic reaction to penicillin 60 years ago. Should that person get the vaccine after taking steroid and Benadryl?
So what I would say is you have a reaction to an injectable, and so you are a 30-minute window and carry an EpiPen kind of thing. The most penicillin allergies actually go away within about 50% go away in 5 years, 80% go away in 10 years. So you're probably not even allergic to penicillin still. So I think you're probably going to be okay. But you would be someone where I would probably watch you for 30 minutes.
Very good. Rakesh is asking a general question. Do all vaccines contain animal product as some are mandated?
I suspect that there is animal testing on all vaccines and animal products, for the proteins, et cetera. I think Gina Shah sent a message on the chat as well that there's going to be a website as well that has more information. Sorry, Dr. Gina Shah. So my suspicion is there's probably some components of animal products kind of in all vaccines.
Is there a provision, Santi Mohanot is asking, for getting vaccines soon ahead of normal turn on travel basis?
No, in terms of getting it sooner than later, I think it's basically going to be these 3 tiers, and every state is implementing it slightly different, and it's a very logistically difficult thing. So there may be some people who get it sooner than later, but in general, these are kind of that's the specifications, and it may vary by state, so it's hard to know. But unlikely, related to travel, and if you have that. No, I don't think you're going to get it earlier, but it's related to kind of your age and where you work and what conditions you have.
Any comments or knowledge that we have about AstraZeneca, Sputnik, and Novavax vaccines? Or even J&J?
Yeah, so AstraZeneca had some issues with their data and their reporting. I think it's getting approved in the UK. It just got approved, and so they're going to be distributing that vaccine. That is really the vaccine that we're hoping for, for the global South, because it doesn't require this intense cooling. Novavax is in phase 3 trial. I think Novavax just had something in the New England Journal on some of its early trials. That may be coming soon. J&J may be coming soon. The Russian and the Chinese ones, we don't have much data on them, so it's very hard to know what's going on with them. There are various countries that are approving them, and there's various countries that have already deployed them on scale or in limited populations, but the data is just not available, and so it's unclear, what the efficacy and safety is for those.
Well, great news for all vegans. Anil Narang is writing that Physicians Committee for Responsible Medicine in DC is developing a vaccine, and that will not. So that's great. Rasmikant Bhai is asking, is there any chance transit, and if given to patient, is it dangerous?
I don't think it's going to be dangerous. It just may not be efficacious, right? It's the same components. There's the lipid, the salts, the mRNA. None of these things are really dangerous. If it's degraded, then you're not going to have that immune response. And, there's going to be serious quality control type mechanisms in place to prevent that from happening. And if in the case that, say, something is sent to like a hospital or CVS and it's thawed and enough time has elapsed, they're not going to use those. So I think there's serious quality control mechanisms in place.
Dinesh Bhai, thanks for your question. Anything more on second strain? Nirav did mention there are not a whole lot of things that we know about the second strain yet. We are just working on it. Another question, if we are not from US but staying here, how do we get vaccine? Good question. I don't know if you will have an answer, Nirav.
Can you repeat that? How do you know you will get the vaccine if what?
Non-US people who are visiting, how can they get a vaccine?
I don't know. That's a good question. That's a very good question. I don't know.
I think you should approach the CVS and Walgreens, which is nearby, because they are the 2 authorized pharmacies who are going to be giving injections, and I'm sure there will be a way that they find to give you a shot. I think so. So just approach them.
I think they're for immigrant communities that are undocumented. They're providing the shot, right? So you don't necessarily have to have papers of some sort in order to get it. So I agree with that you probably will be able to, when it's widely available, just like the flu shot, a little bit later, I think you'll be able to go and get it.
You got frozen or broken up, but no worries. Just asking you in general, complex, DC, and North. What is the general, 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 and zinc. Those are the recommendations for things at home. You may want to add taking a Z-pack antibiotics, but that's about it. The rest are all based on the symptoms rather than anything else. And if you have respiratory symptoms of shortness of breath and or oxygen saturation going down, that will be definitely an indication to rush to the hospital. I think we are reaching the time limit. We will have another 2-3 minutes, so I'll see if I can catch up with 1 or 2 more questions. Should there be tests for immune response randomly among people who are vaccinated, Ramaswamy? Nirav, are you still there?
Yeah, can you hear me?
Yes, we can hear you.
Yeah, you don't necessarily, you don't need to get you don't need to get an immune test to see if you have efficacy, right? It's the studies have already shown that exists, so you don't need to get a test to confirm that the vaccine is effective.
If we are resident of one state and staying in another state, then how does it work? I think you still should be able to get the vaccination if you approach CVS, Walgreens, etc., because it's nationwide, so I don't think you'll have to worry. Galaxy is asking which vaccines are vegan. Would you have all the ingredients of vegan vaccines? Dr. Jinasa is working on it. Please look out for that on the website. I don't think Nirav or I have the answer to that question. Another one, is it okay to take vaccine with autoimmune disease? Nirav, you can probably help there.
Right. I mean, so asthma and lupus and all these other things are autoimmune diseases. They were not restricted when they initially did this, so you're totally okay.
Great. What is the vaccine status in India? I personally, all that I know is that they haven't rolled it out yet. But do you have any other information?
I mean, I think they, Bharat Pharmaceuticals started making some Oxford, and then there's probably maybe some. I don't know if they're going to approve, the Russian or the Chinese ones. I think there's going to be a lot of difficulty with Moderna or Pfizer potentially doing that. But like I said, it's a large population. I think they have the capacity to make a lot of vaccines and stuff. But they're going to need something that's a little bit more easy to to store and distribute. But I can't say anything further than that.
Great. Dr. Manish Mehta is thanking you for accepting talk, Nirav, and he says you have a namesake at CDC Maine. Is he a Jain too? Do you know him?
I have namesakes all over the place. I mean, the Illinois Department of Public Health director was NIRAV SHAH. Maine was. There's a guy in California that you probably know. There's a lot of us.
Yes.
We should claim them as all Jain. So.
That's right. We can just claim. Hello, can you hear me?
Yep.
Okay. Somehow it seemed that I got disconnected. Well, anyway, our time is up, and I really enjoyed Nirav these rapid fire questions. I think you are excellent with short and sweet answers. And Michai Midukram, to anybody, if we could not get to your questions, it was totally unintentional. There was no reason to pick and choose. We did our best to speak fast and get through as many questions as possible. We appreciate everybody's patience in joining. And with that, we will conclude this session. Thank you, Jaina, for hosting. And thank you, Mahesh Bhai Vadar, the president, and Hemant Bhai for asking me to moderate the question answer, and of course, Dr. Nitha for offering your time. Thank you. Jai Janendra. Stay safe and take the vaccine if you
Jai Janendra, thank you very much. We enjoyed the session.
Thank you, Nira.
Everyone, no problem. Thank you, everyone. Get vaccinated.
Yes, thank you very much.
Thank you. Thank you. Thank you, Nirav. Thank you, Nirav bhai.
Yep. Thank you.
Thank you, doctor.
Thank you, Jai Janendra.
Thank you.
Thank you. Thank you very much.
Thank you.
Thank you. Thank you. Thank you.
Thank you.
Bye. Thank you, Nitin. Bye.
Welcome, sir.
Thank you for nice information, Doc.
Thank you for joining.
Thank you.
Go back. Thank you.